for the contributions you've made. I know that opening yourselves up can be a very traumatic experience. We're going to open the meeting up now to the committee members to ask questions. Now, if you think that the question is going into an area which you find too intrusive, too personal, whatever, just say so, and we won't expect any responses if you feel that the response is one that you don't want to give. So don't feel as though you're under any pressure to give any information or say anything that you're not comfortable with. You're completely in charge of the answers that you give, but any information that you can give us would obviously be very welcome. Okay, is that okay? Okay. I'll kick off by asking Mr. Sherlock a question. It's because I've been speaking to a lot of people about the process by which ATOS are doing these assessments. Since you're the one who raised specifically your feelings of being harassed, victimisation, some people have suggested to me that to focus on ATOS is actually to get away from the point, and actually what's happening here is it's the government that are behind this, and the ATOS are only the vehicle by which this is taking place. However, when you hear what your experience of ATOS is, that you can't justify what they're doing on the basis that they're only acting on the instructions of the government. Is that your feeling?
Well, yeah, I mean, ATOS has actually been in agreement with DWP in the way forward, so it's not a one-way traffic thing. I mean, ATOS has agreed the actual, in principle, the contract within DWP. So DWP, at the end of the day, is responsible for whoever they contract out. So yes, yeah, it is DWP's responsibility. But ATOS is a private, organisation, which really... There should be other things that come into the factor of making sure that they are abiding by the rules that are in the public domain. I find it very confusing that we have DWP on one side, and then we've got a private company on the other side, and both of them blaming each other for problems. ATOS seem to pass the buck on to DWP. And when you approach DWP and Job Centre Plus staff, they say it's all down to ATOS. So the customer, is left basically who is responsible. And as a layperson, you're even more lost because you don't know who is responsible and who to complain to. So I think it's in that answer, it's both people should take the responsibility and both people to blame.
That's really helpful. To the three of you, I mean, obviously you'll be talking to other people who might have similar experiences. Can you give us an idea of the scale of the problem we're talking about here in terms of the impact on individuals within the areas of your knowledge, and just how are ATOS impacting in terms of those people? Yeah, Mr. Gray?
In my regard, not many in the autistic spectrum area have actually been called forward yet for any assessment because they're working on a different kind of basis. But there's an amazing number who aren't aware of the consequences and reaction of what's happening. There's not an awareness, certainly in the autistic spectrum community, of what's happening with ATOS, especially with the changes in the DLA to PIP. And they just see it as, well, a process is happening, but I've got my DLA for life. And therefore, to them, it just bypasses them. It's not relevant to me. So there's a need for a growing awareness of what's happening. That's why, for example, with today's paper, with the record part of it, it really does raise an awareness of the situation, what's changing.
Something I've discovered through various websites and speaking to people as well that have been through the ATOS medical assessments. I actually went to my husband's with him. Is just how much lies, and I can honestly say it's lies that go into their assessment. I do shorthand, and I took it down word for word, my husband's whole assessment. And what was actually came back, my husband said, was totally different. Practically the opposite of everything he said. And I've heard that from many other people that have been as well. And they seem to think, if you can sit down for half an hour, or you can hold a job for 35 hours a week. If you can make yourself a cup of tea, that's you can make yourself a 3-course meal. There's they question you in such a way, and they twist it round so they practically make you out to be a full able-bodied person that can you're practically an athlete by the time they're finished with you. I don't know where that comes from, whether that's their ethos or if that's something they've set up with the DWP or not. But it certainly traumatises and upsets an awful lot of people who feel they've been made out to be liars. In fact, I read, I think it was just today or yesterday, that someone else that they said should go out and get a job has died within 4 or 5 months after it while waiting on their decision. And that was, that's not the first time that's happened. They're actually, was supposed to save this country money. They are actually costing this country money, ATOS. Because the amount of money that's being, they don't get fined when they get things wrong. Nothing happens when they get anything wrong. There's more people going to tribunal now in this past 4 years than there has done in the last 10 years. And there's a lot of money spent on one tribunal. There's thousands of them. There's now a waiting list in Scotland, well, Edinburgh area. It used to be about 3 to 4 months. It's now 9 months to a year you wait to get to a tribunal. The tribunal staff are actually on their knees with the workload that they've got. And the biggest majority of the assessments ATOS do go to tribunal. And that shouldn't, if they're doing their job right, that shouldn't happen. I'm sorry, it just shouldn't happen.
Well, we've heard that evidence before, the amount of people who are going to tribunal and actually winning their case when it's heard by people independent of the assessment process. So that's a major concern that's been brought to the committee before. Yeah,
can I say as well, if you're put in front of, if you have been working and your company sends you to occupational health, totally independent of the company you work for. Now, occupational health is different from your GP in that, they can measure if you're fit for work or any kind of work. And if you've got a report saying, no, you're not fit for work, you never will be fit for work again, why can't they take that on board? Why is it not good enough for them? Because some of the people you actually see there, they're not qualified occupational health. Some of them are only just nurses. Some of them know nothing about the condition you're there for. It's not, it's not their area. Again, that is another thing I think they should be looking at.
That's very important information. I'll open up to other members of the committee. I'll go to Jamie first. Jamie
Convener, can I thank our 3 witnesses for their evidence. We've had some good evidence, I think, Convener, from some of the representative organisations, but I think it's been very, very helpful to hear directly from your own personal experience of the system, as it were. I've got some questions for Mr. Ray, but just before I go to them, because I thought it was interesting to hear Mrs. Scott's obviously essentially saying that she feels that there's lies being told through the assessment process, which is obviously a serious charge to level. But I just wonder if you get the sense that essentially anyone that's going forward for assessment, rather than it being an open assessment, the people that are undertaking the assessment have the attitude that they're there to disprove the person. Is that what you feel?
Yeah, I've actually been for a medical assessment myself with ATOS, and to be quite honest, from the beginning to the end of the assessment was really traumatic. I was aware that the welfare reforms were in, but the first communication I got wasn't from DWP, it was from ATOS themselves. They phoned me on a Saturday at 8 p.m. at night, and I thought it was a bogus call. And they said, I just need to phone up to see that you are Mr. Henry Sherlock. And I said, sorry, who are you? They says, well, we're ATOS Healthcare. And I says, well, and who are you? And they says, well, we're here to send you for a medical assessment. And at first I thought it was the hospital, Forth Valley NHS. So I was totally confused and thinking, why are they phoning me on a Saturday? So then when I asked more questions, they couldn't really answer them. They said, well, all we need to do is confirm your national insurance number with you so we know we've got the right person. I says, I'm sorry, but I'm not speaking to a stranger on the phone. I've heard about, identity fraud and everything, and I am not giving out my national insurance number to anybody. To which the person from ATOS said, well, look, if you do not give us your national insurance number, then we will stop your benefit. So now that was the first contact from ATOS.
So that could obviously be perceived to be quite threatening. But I suppose the question more, when you're actually there for assessment, do you get the sense that it's a genuine assessment, or that it's more a case of
absolutely
prove it?
Not.
We're here to disprove that.
Yeah, I mean,
almost as if you've the sense that you've come in and they're treating you as if you're a liar?
Absolutely.
Is that the sense you have?
I mean, the problem is the way that the questions are actually asked. The way the questions are asked, I was asked, could I pick up an empty cardboard box? What job picks up an empty cardboard box? So it's not even work-capable assessment. But when I said, well, physically, yes, I can pick up a empty cardboard box, but I don't know where the cardboard box is. I'd have to have someone show me where the box is. Then when I pick up the box, if I need 2 hands, I then become immobile. My mobility is gone because I can't use a cane and I can't use a dog to get round. And I gave full explanation as to why this was so difficult. And because I actually asked for the medical report to be sent to me, and in the report that was missed completely. All it said was I was capable of physically lifting a cardboard box. Nothing at all to do with my disability, and nothing associated with it. And the same with getting to the event. I was told that I managed to get the event, I got there on time, even though, I shouldn't have been at the event. They should have come to me by law under their own contract. And also the fact that I had a companion with me, because I was asked to go to an area that I'd never been. I took a companion with me. That was never mentioned. All that was mentioned was a smartly dressed, no food stains, very polite, and mobility-wise I could walk. But I couldn't find my way around the building without that additional, sighted support. That was never mentioned. So I wouldn't say the case was that they were intentionally lying, but they were intentionally missing things out that would give that give you a positive outcome.
Can I just interrupt?
Annabelle.
Sure. Annabelle Ewing, are you saying that in the final report they didn't mention that you were blind?
No, they did mention that I was blind, but what they didn't mention was the fact that I needed support to get to the event, or support, to find the chair in the room. Everything that was down in that report was basically geared towards removing the benefit. There was nothing to say what support I required to get to the event, just that I arrived there on time and was smartly dressed and spoke well.
Okay.
I wonder if it would have been better if you'd turned up late and not been smartly dressed then.
Absolutely.
Anyway, Mrs. Scott.
They seem to say that in all the reports. That's one of the first things they say. You were smartly dressed, there's no stains or anything. Polite and kind of well-spoken, it seems to be a standard.
It's a tick box.
Yeah.
Seems
Most of them are tick
what relevance
boxes.
might that have to whether or not you
There's no individuality to your condition at all. It's just tick boxes. And when I was there with my husband, they were doing his. It's actually all done on ATOS. ATOS has the package on the computer, and while the doctor, nurse or whatever is doing a part examination, at the same time they're also sitting down and typing in something to the computer, while at the same time they were asking my husband questions, who was answering, and I was at the same time taking it down word for word, because I knew I could get a copy later to compare it. And they're not actually putting anything down that you're saying. It's just a matter of tick boxes. Can you do and can you do? Oh, yes, yes, yes. Nothing about the problems maybe that you have behind it. I mean, lots of people, disabled people, can do lots of things, but they can't do it on a consistent basis. They didn't ask anything like that at all.
Can we just ask a couple of questions, Mr. Gray, because I thought it was very interesting to hear and depressing, also to hear the impact that it might have on the changes might have on Andrew's life in terms of the impact on his mortgage, and also I did wonder if you were concerned, because it was interesting to hear you say that you've set up direct debits to pay for all of Andrew's bills, and presumably they could be, your concern is that could be impacted on with any change to his financial circumstances. I wonder if you'd share with me then, it seems somewhat ironic then that some of the changes to the benefit system we are hearing are predicated on the basis of trying to encourage financial independence. It sounds to me as though these changes are doing exactly the opposite, potentially in Andrew's case. Would that be a fair reflection?
Yes, it would actually remove a lot of independence, and his money at the moment is well managed, and if he then became the spat, he would start mismanaging his money, and that would cause more problems. You'd also find that some of his things would have to go. For example, he swims, he does a lot of swim training. We'd have to give up that side if he lost his benefit. And therefore you're now saying there should be more sport taking place, but he would have to give up sport and stop with his concessions, something that he gets. As I said before, his pass, entitlement card, if that went, he would again be stuck. He would only be able to do half of what he does at the present moment.
But in terms of his financial management, it would have a definite impact, which seems contrary to what we've been told.
We'd have to look at what he can do, where he can be. For example, the moment he contributes to his own personal pension, looking forward to when he retires later on, he puts some of his weekly salary into that pension. That would definitely go very early on, because he can't afford. He's looking at what would happen in terms of making sure I can live, as against making sure of my future. So his future would be the thing again that would come into play. So then you're saying, if his future's coming into play, the state's going to have to pay him more in the end when he's older, or whatever date they decide he's going to pay him.
Can I ask just one further question, and I hope it's not one of the intrusive questions that we refer to. If it is, please feel free not to answer. But you spoke of the difficulties your son has understanding that the system is changing. You know, he's been told that he will get this benefit for life, essentially, and now that's changed. I just wonder if you could tell us a little bit more how that has actually impacted on him and indeed yourselves as a family.
Not really, initially didn't impact much on him, but when I started becoming involved, he realised it was serious at that point. So as far as he's concerned, he might lose his DLA, he's going to lose money, and that's a big concern to him. The other side he hadn't thought about really until I mentioned it, what happens to his bus pass and the other factors, what happens to his tax credits. When I said to him, what's going to happen to your tax credits, he looked quite shocked, because obviously his DLA is his disability side, gives him his tax credits because he's working part-time and can't work full-time.
Had a negative impact on his mental well-being?
Certainly a week. He was really difficult.
Okay.
Invading space, being a nuisance, just fidgeting around, not himself.
Okay, thank you.
And he doesn't ask, because he can't associate his mind that I'm losing benefit, but he doesn't think these things follow on from the fact I lose a benefit. There's too much black and white, and it doesn't extrapolate out into the factors.
Thank you for that.
Thank you.
Kevin Stewart.
Thank you, Convener, and I'd like to thank you for giving evidence to the committee here today. I think it's very brave of you to do so, and while we individually have talked to many people around about this, I think it's good that you can give your message to a lot more folk who are out there, because I think that many folk think that these changes are having a major effect on them, but not necessarily everyone else. I want to concentrate on the issues that you all brought up round about losing independence and feeling isolated. And Mr. Gray, if I could maybe turn to you first, and you stated about Andrew's job, that if that were to go, that would be him losing his independence, which I'm sure would create even greater isolation for him. What do you think that would actually mean if that were to happen?
I'm not sure. I really don't know what he would do. Certainly, normally the way working is on a Sunday he's told what he's working during the week, and if he comes in with only 2 or 3 shifts, he is not happy, and he takes it out again on us at home. So what would happen if you said to him, "You don't have a job"? I wouldn't be able to think about it. You can't really read his mind as what he's thinking inside, but we do know that when things go wrong and he can't work out his own solution to it, he then gets up to things that are Andrewisms, that he'll hide things, he'll break things, he'll do things without seeing the consequences. It has got him into trouble before with the justice system, from that very same factor of not knowing what he's doing, not being aware of it, and it's a way of getting revenge. In his case, he would look at it and say, I've been damaged, I've been got at by the state, so he'd then look for some way of getting revenge back on external agencies or whatever. It's a very complex thing to know, and we can't really read how he would react to it, but he certainly would react, and it might have very bad consequences.
I find it somewhat ironic that these changes may actually stop folk who are currently working from working because of the circumstances. And I mean, do you think in these circumstances there should be a look at the individual case and tailoring the benefit to the individual because, well, as you rightly say in your evidence, your son is contributing to society?
Yeah. In this case, when I talked about the 5 hours working, for example, that didn't come from me. When I was talking of raising his hours with hotel and possibly putting into full-time, they said no. Both the manager and his mentor both said no, and they would not cope. 5 hours, independently, they both said 5 hours is his limit. So you actually, if you take away his benefit, you're then causing him to actually have tremendous stress at work.
Thanks for that. If I could turn to Mrs. Scott in the same situation round about independence and isolation. Obviously, your husband, having worked as long as he did do, and probably finds it extremely difficult not to work at this moment in time and not to be able to contribute. You state in your evidence that that basically he will lose his independence in that regard and feel more isolated. What do you think that is doing to your husband's mental health at this moment? That may be too intrusive if you don't wish to answer.
No, I think it's made him quite depressed about it all. Made him feel, well, less of a man really for being able to contribute. And what's made it even worse is helpless, because there's nothing he can do about it. You know, he can't go out and get a job. He's not able to work. He knows that. His consultant knows that. Occupational health know that. He'd love to go back to do what he did before, or even get some kind of job, but he isn't fit. Apart from the stroke having caused, you know, disabilities in his walking and everything, it's also left him with some slight brain damage as well. And he's not as quick and stuff, and his memory's not great and stuff either, as you know, as what it used to be. And it just makes him feel, as I say, less of a man, and just not, because there's nothing he can do about it. It makes him feel pretty helpless, really, and victimised at the same time for having worked all these years and contributed, and now that he actually needs it, he's not getting it.
Yeah. Somebody who obviously believed that paying into the system,
you pay into the
would
system,
ensure that the state looked after you if anything happened.
Yeah. I mean, it's not something we ever envisaged. You know, we sort of looked at the both of us retiring. He'd retire at 65, and I would retire 60, and we kind of looked at it that way. We didn't think about anything like this happening at all, you know, and it's quite difficult for him to take. Really, as I said, it's a helpless feeling for somebody who's worked and contributed all their days not to be able to do that anymore. And of course, that can make you pretty low.
Thank you very much, Mr. Sherlock. If I could turn to yourself. Obviously, we have the great privilege of working with our colleague Dennis Robertson, who is blind, and that gives us a little bit of an insight into the kind of things that you face. But when I say a little, it's probably a very little. Obviously, you have talked about losing independence, and you talked about previously isolation at work. If you were to see a major change to your benefits, how would that affect you, do you think?
It would affect me in many different ways, because being blind, you are isolated. You do feel isolated because a lot of the world is all visual. You know, everything's visual now, everything's touch screen. You know, progress has left us behind, unfortunately. So the only access to information I have at the moment, although there's talking newspapers, what people don't realise is talking newspapers only give you a little bit of the news. It doesn't give you the full paper.
Sure.
So it's only little snatches of the news. So I use my computer so that I can go on websites, listen to what's going on in the community. I can contact family on things like Skype, because then it doesn't cost me a phone bill.
Yeah.
You know, these are the savings that I make. And using the specialist equipment is the only way that I can actually communicate by email. You know, so that I have the free independence of communicating with family, friends, and whoever by email because of a talking computer. But the benefits, if they're removed, I will not be able to afford to continue with that. because you have to upgrade it every so often, which is at a cost. Computers don't last forever. They get left behind within 12 months, so you're always upgrading. So without my PC at home, I would then be cut off from, you know, the whole world, really. And then looking at the future with additional benefits being cut, my DLA at the moment doesn't pay because I live in a rural area. It doesn't take into consideration that I live in a rural area, and it's more expensive for me to get a taxi from there even to town. I mean, it costs £15 from my home to town. The benefit I get at the moment pays for one night out a month. And that's my social aspect at the moment. If it gets reduced, my social life will go completely, absolutely completely. At the moment, I rely on family and friends to support me. You know, my brother pays for my phone bill because I can't afford to. Without my phone, I'd be isolated. I can't do that for the rest of my life. And if the benefits are reduced even more, I dread to think, you know, how isolated I will become.
So that communication in terms of your PC and your telephone, which somebody else pays for you at this moment in time, without those, you would be completely and utterly isolated in a rural setting where you wouldn't even be able to go out for that one night a month.
Yeah, absolutely, yeah.
Thank you very much for that evidence.
I mean, that impact as well has an impact on your mental health.
Absolutely.
Which then has an impact on the NHS. You know, so instead of being less cost effective, it becomes more costly, you know, or could become a danger and more costly.
Thank you very much.
Linda Fabiani.
Thank you very much. I'd like to start with a question to Mr. Gray, if you don't mind, Mr. Gray. I was really interested because it's struck a chord with me that I've heard in the constituency about the fact Andrew, when he's asked questions, whether it be by ATOS or social workers or whatever, quite often gives the answer that he thinks the person wants to hear. Or indeed, I've heard it said before, someone in Andrew's position may well give the opinion that he last heard. Yeah. And I'm just, first of all, a technical question. If someone like Andrew goes along for that assessment, is it possible to have someone with him who can in fact contradict? And would that be taken seriously? Or does it get back to we want to hear from the person with their own personal views and the pretence that you can do that in a very quick interview and ignore those who are round about and know that person really well?
Certainly, from my understanding, there's somebody can go to advocate with him. But the question is that Andrew wouldn't keep his mouth shut. He got to put his bit in. Even yesterday when he speak to the papers, I'd warned him, keep your mouth shut and watch. When he started to speak, he still couldn't keep his mouth shut. So he would then come in and intervene and break up what was saying. So people who are doing the interviewing are then faced with the dilemma of who do they believe. His advocate would be myself, who's maybe got my own agenda to speak to, or Andrew, who's the person they're really concerned with. And I'm quite sure they'll turn to Andrew's views rather than their own views.
Which leads me on to, Convener, the concern that if someone, like Andrew, perhaps in the same spectrum at different levels, didn't have someone who cared to advocate on their behalf and left that assessment having given all the right answers because that's expected, and then goes home and has no one to at least help to put it right, it would seem to me that's a terrible, terrible thing to be doing to people.
Yep. Sense of money.
Yeah. Yeah. And I suppose, for Mrs. Scott too, sitting there listening to your husband, Mrs. Scott, who, suffers all the frustrations and what you're talking about lack of self-esteem, etc., may not always be absolutely truthful, to use the word, in what he responds, because there is a level of despair about that, and it must be frustrating for you sitting listening, knowing perhaps that the case is not as straightforward as he's putting it over.
Yeah, well, as I said, when I went with him to the medical that he had, he was very truthful, and quite a few times I had to sort of jump in and say, no, that's what you used to do, but you don't do that now. You're not capable. He, at that particular point, when we had the interview, he just, that was what, maybe about 6 months, a year into, just after, 6 months I think after he having the stroke. He still wanted to think that he just as he was before. And he wasn't. You know, there was medical evidence to prove that he wasn't. But yeah, there quite a few times I had to say something that as it was at that time. But that wasn't actually registered or anything that I said.
Can I come in on that point, Karina?
Yeah.
I think one of the things which we've heard from other people who've been thinking about it after the event of being assessed is that they always try to perform at their very best, and yet that may be the best they can do that day, and are unable to do the same thing again for a month or 2 months because they have overstretched. Do you think, in the case of your husband, that's the kind of thing that he did when he was being assessed?
Yes, I think so. I mean, he made sure that he make sure I've got clean clothes to go and, you know, shaved and everything like that. I had to help him have a shower and get shaved and everything before he went. And I think too, you know, people are proud. They don't want to sit in front of a stranger and tell them, you know, they can't do or they're not able or whatever, even though it's the truth, because they were perfectly capable of doing it before. You know, there's that bit comes into it too, you know, and sometimes you do need someone there to say, look, I'm sorry, but this isn't the way it is any longer. And as I said, you know, my husband for a while didn't want to admit that he just wasn't capable or able to do stuff. And there'll be many people like that have the ATOS interviews, especially, as I said, maybe elderly people who are very proud and don't want to let on there's too much wrong with them, you know.
Linda, you wanted to finish that
Yes,
point here?
Linda Fabiani again, Mr. Sherlock. I guess it's what Mr. Sherlock was saying then, the fact that there is no individuality and it's a tick box system. And it's almost like there's this massive machine there between ATOS and DWP and no one can break out of it. Is the level of sort of uniformity such that so very, very many people are getting left behind and really not getting a fair shout when they turn up at these interviews?
Absolutely, because, I mean, not everybody fits into a box. I mean, you can even go into the spectrum of visual impairments. Not everybody will fit into one certain box in that view. And as regards myself,